Made famous from her role in the hit sitcom WKRP in Cincinnati, and nominated for 2 Emmy Awards and 3 Golden Globe Awards, actress Loni Anderson has been a spokesperson for COPD since 1999. Welcome, Loni. Thank you so much for coming.
Oh, thank you. It's my pleasure to be here with you.
Tell us about your experience with COPD.
My experience has been that both of my parents had COPD, but nobody called it that when they were younger. And so I lost them. They were very young. My dad was only 54 when he died.
Oh, wow.
And my mom, 60. And they had parents that lived to be into their 90s. So they were heavy smokers.
Yes.
And from World War II. Yeah. So that was what brought me into it, that I lost them so soon.
Yes.
And I wanted to make sure that other people would be aware of what smoking does.
At what age did you understand what COPD was? Because most people just don't.
Well, even though it didn't have the letters, I knew that my dad had chronic bronchitis even when I was about 5 years old.
Wow.
He was coughing. And my sister and I always had this joke. We'd say, well, we don't need an alarm because when Dad starts coughing, it's time to get up and get ready for school, you know. And so it just became, nobody thought anything of it except that was just a part of it.
Yeah.
And later on, when I got a little older, he would tell me about experiences he'd had, like walking down the street and losing his breath and having a coughing fit and having to lean against the wall to hold him up, and how embarrassed he was when people would look at him and wonder what was going on. And so, yeah, he was, from the time he was 29 years old.
So he really struggled with that for a long time.
And he smoked from the time he was like 14.
Yeah.
Because Humphrey Bogart smoked, and it was just so cool.
And it was before people really understood the significant impact of smoking.
Well, in 1964, when the cigarette pack said, and the Surgeon General said, this is dangerous, up until then, nobody thought anything of it. You know, you could be sitting across from your doctor, and he'd offer you a cigarette, and you'd sit there
Can you
smoking,
imagine?
and discussing how you're doing.
Nobody understood the addictiveness of nicotine.
No.
You know, and it's very powerful.
Very.
You know. In terms of, did you ever smoke, ever?
I never did, because I grew up in a purple haze.
Right.
Our house was just filled with smoke. Just think the car windows were rolled up, you know, on the family trip, my sister and I sitting in the back seat. We both have beginning symptoms of asthma, really, because of smoking, secondhand smoke. And I've been tested for COPD, and it's just the asthma thing that I'm having right now.
I think the thing that has always bothered me is when a mom and dad smokes and they're doing the secondhand smoking to their kids. The kids don't have any choice whatsoever.
Exactly.
And they're exposed to it.
Exactly. And in our generation, the kids, you know, all the parents smoked, and so you were completely surrounded by it. And your clothes smelled like it, and your hair smelled like it, and your house was filled with smoke. And I grew up in Minnesota. The doors were closed pretty much. It's
so
chilly.
Cold.
Yeah, and so yeah, a lot of secondhand smoke, even though I never smoked.
What was it like helping to take care of your parents with
this
illness?
It's those middle of the night panic calls that are the most frightening.
Yeah.
I can't breathe. I need to go to the hospital.
Yeah.
And when I moved to Los Angeles, they weren't in Los Angeles, and so I was always in a panic, trying to find out, did they get to the hospital? When can I get a plane to get there? And so it was, being long distance for me was really, really tough.
How impactful was it, your parents dying so young from this?
Wow. You know, you think your parents are always going to be there, because we always think there's never the right time to lose your parents.
Of course.
But you do think that they're going to be there when you're an older person and see their grandchildren grow up. And I had grandmas and grandpas, and I was thinking about my son never knew them.
Yeah.
And so I missed them. They missed him. And so that it makes like a marker in your life when you thought, now I've lived longer than my dad. Now I've lived longer than my mom. And then you realize all the years that you lived past the age that they went,
Yeah.
how much they missed.
Yeah, it kind of leaves a little bit of a hole in the
Oh,
family.
absolutely.
Yeah.
I talk about them all the time. I miss them every day.
Yeah. Now you have taken that and really become an activist kind of for making people aware of this disease. Tell us about that.
Well, I think it started for me. I always felt that way. And when Quentin, my son, was about 10 years old, I knew this was the time. People think you choose to smoke later. High school's really too late. We always talk about that. That really junior high and
Is the
elementary
time.
school, kids are making that choice.
Yeah.
Are they going to smoke or not? And I saw him at about 10 or 11, and I'm thinking, okay, how do I make this something that he chooses not to do?
Yes, such an
And
important
he
thing.
doesn't find it glamorous.
Yeah.
And so I got involved and got out there and got on television and radio, newspapers, wherever I could go, and traveled around making people aware of
Yeah.
COPD. And so maybe I could I remember him saying to me when I left the house for one of my tours, he would say, just get out there, Mom, and one person that doesn't smoke, that's the best thing. And, you
Yes.
know, he was just cheering me on. But he's not a smoker.
And you stepped in to make a difference. That's wonderful. We have to take a break, but when we come back, we're going to meet someone who struggles with COPD, and we'll meet his new doctor.
Stay tuned. We'll be right back.
Joining us now is Terry Ridgeway, who recently relocated from the Tucson desert to sea level to ease his condition, and Dr. James Krueger, a pulmonologist in private practice from Long Beach, California. Welcome.
Oh, thank you.
Terry, tell us about your experience with COPD.
Well, I've had COPD for actually a very long time, maybe even before I knew it.
Realized it?
I was a heavy smoker.
Okay.
Started when I was about 13 years
Oh,
old.
wow. Right when
Like
you were
my
talking
dad
about
and mom,
it. Yeah.
absolutely.
Yeah.
Middle school.
I delivered the papers down in Long Beach, California, and found a pack of cigarettes on the.
Oh, you're kidding. That's how you started. You
Well,
found
my
a pack of
folks
cigarettes.
smoked,
Okay.
and I think I had tried, but I found a whole pack, and I think it fell out of somebody that was going to church at Mass, early Mass, and got it, and I figured my mother always said, waste not and want not. And so I smoked them. Probably took me a week to smoke them, but
Wow.
I was hooked, and it built up to my normal, which was about 3 packs a day.
Wow.
My parents do like 3 or 4 packs a day.
Wow.
And, you
Dr.
know,
Krueger,
it's
can you
just-
give us the clinical terms of what COPD is?
Sure. COPD stands for chronic obstructive pulmonary disease, and the definition is airflow limitation. There's 3 subtypes of COPD. Number 1 is emphysema, smoking. Number 2 is chronic bronchitis, and number 3 is chronic obstructive asthma. About 80% of emphysema is smoking related, so there's 20% that isn't.
Okay.
And that other 20%, there's a genetic type of emphysema called alpha-1 antitrypsin. People in third world countries who are exposed to biomass, indoor cooking, smog, ozone, pesticides, inorganic, organic dusts.
Yeah.
So it's a very large spectrum
So really exposure to multiple things, but probably smoking is the most common
by
exposure.
far.
How many years would you say someone would have to smoke to potentially get COPD?
The way in pulmonary that we define that is by what's called pack years.
Okay.
Number of packs per day times number of years. So if you smoke 1 pack per day for 30 years, that's 30 pack years. 3 packs per day for 50 years, Terry, is 150 pack years. We generally see symptoms of COPD at about 25 to 30 pack years.
Is that what you experienced, Terry? How old
I
were
think
you
so.
when
I
you?
was probably in my 20s when I
Okay.
first realized I was getting short of breath.
And did you know right away it was from the smoking?
I knew,
Yeah.
you know, back then, things have changed about smoking, but they used to say that smoking didn't cause
Right.
cancer or lung problems. You know, it was not true.
Right.
But I knew it. In my heart, I knew.
What activities can't you do now because of?
Oh, there's so many activities I can't do that I wish I could do. I just moved here from Tucson, and
Yeah.
my pulmonologist in Tucson said, for example, I can't go above 2,500 feet.
Wow.
And that's about the height of Tucson. Can't even go to the mountains, you know, right there at Tucson. Can't fly in an airplane there. I think the new Dreamliner is pressurized to 6,000 feet, not sea level. I moved to Long Beach because of emphysema
take
get
care of
to sea level. And I was considering either Long Beach or Israel. My wife is an Israeli citizen. Okay. And we considered that too.
Can you walk for long periods of time, or what would you say? Or no?
I can walk reasonably well considering
Okay.
my level of emphysema. But like if I walk the dogs, my dogs are very, very, very strong, and they're hard to control.
You have to be careful when you're walking dogs, don't you?
So I cannot walk them very far.
Tell us, as part of your story, have you been able to stop smoking?
Yeah, I did quit smoking. I quit smoking about 12 years ago.
Oh, good for you.
I may have quit once before. I had, at one time, I had found myself, I stopped taking medicine. I'd use it. You mentioned Advair.
Advair.
And I quit taking that medicine. I felt good. And then one night, about 3 o'clock in the morning, I woke up and I couldn't breathe, and took my inhaler, my emergency inhaler, and usually starts to give you some air quickly, or opens your lungs up. Didn't work. So I called 911 and they came and got me. But before they could get there, I had passed out and stopped breathing altogether. And they had to intubate me and get me going. And I went to the hospital, and then I knew then that I had to quit smoking. I immediately quit about 5 years after that. And the reason I mention that is because it's addictive.
It's so hard.
It's hard. Were your parents
My
able
parents,
to?
it's so hard. My dad, even though he was diagnosed, he quit smoking, and on his deathbed asked for a cigarette. So he just couldn't stand it. And my mother smoked. Even though they told her not to, she smoked up until the day she died. She couldn't stop.
It's so
If her
difficult.
first thing is she woke up in the morning, put her feet on the floor, lit up.
That
Didn't
sounded
even
like
get
me.
out of bed without a cigarette.
Besides your parents, Lonnie, what gives you the greatest passion in creating awareness for this?
Well, young people. And as I said, my son had, I really realized that he was at that age to make a choice. But I speak to a lot of young people, and as we said, we realized that high school is almost too late to get the word out.
Dr. Krueger, do you feel like we're making progress in this area, getting the awareness out and preventing people from starting
I
smoking?
think it's improving. Worldwide, 1 billion, with a B, 1 billion people smoke cigarettes. About 5% have COPD, they're symptomatic from that. But I think what's important for people to know too is nicotine is addicting, but nicotine does not cause COPD. It's the other chemicals in the tobacco that cause the COPD, not nicotine. So there are ways to quit: nicotine gum, nicotine patches, there are pills. People even talk about vaping as an aid to quit smoking. The FDA licensed nicotine. There's Nicotrol, nicotine inhalers. So there are ways to quit,
options.
but you need to be motivated.
Absolutely.
And how do we motivate people? Well, I think people like Terry, Lonnie can help us. The best way to quit is never to get started, honestly. It's horribly addictive.
But nicotine addiction drives you to smoke, correct? That's
well,
the
I think
biggest
that's
thing.
how they get started with the
Right.
addiction, is with the cigarettes, right?
Right.
Right. So then they crave that cigarette, right?
Right.
My producer is motivating me to take a break right now, so we are going to take a short break, and we'll be back with our panel right after this.
Stay tuned for more Lifestyle Magazine.
I realize this conversation may not be pleasant, but it is so important that we have it. This is a real issue, and we need to talk about it. And Dr. Krueger, I'd like to pick up on the idea of vaping, because some people feel like this is a safe alternative. Is it?
We don't know a lot about vaping yet. There's been a few studies, one that showed and analyzed the cloud from the vape.
Yes.
And it contained formaldehyde. So formaldehyde is a class 1 carcinogen. So those who are directly inhaling it versus or those who are inhaling it secondhand, I wouldn't. But it's probably going to take another 10, maybe 20 years to figure out exactly how much cancer it's going to cause, how much obstructive lung disease, just like it took a while to figure out that cigarettes were bad for us.
Yeah, and that was a follow-up question is, well, what about secondhand experience from the vaping? But with the formaldehyde, it really does not feel like this is a very safe alternative.
Yeah, intuitively you'd have to say this is a horrible thing. I wouldn't go anywhere near it.
I wouldn't want to smell formaldehyde. Formaldehyde plume and you walk through. And I thought it was safer to be around that sort of thing. What are some of the most dangerous smoking habits that you see people engaging in today?
Yeah, the new one that young people are doing is the hookah pipe. And a hookah pipe, I understand, is it's like a mega cigarette. There's just a lot of tobacco, a lot of carcinogen, absolutely horrible. And because there's the new tax in the state of California on cigarettes, people are switching to cigars. Not a good idea. A cigar is just as bad, if not worse, than a cigarette. Wow. So no cigars, no rolling your own. It's all bad for you. Just don't get started with that.
Yeah.
What's happening in the lungs when they smoke these things? Get this carbon dioxide going in. Is there any way to try to get it out of your lungs so you can breathe better?
I think the best way to think of it is think of the lung as a sponge, because it actually kind of looks like the sponge laying in your kitchen sink. And it's made up of 200 to 250 million little tiny hollow microscopic sphericals called alveoli. Every time we inhale a cigarette, it's like a little moth goes through our lungs and puts holes in it.
Oh, wow.
So we've got this sponge with just all these holes, and we're inhaling this smoke, this carbon monoxide, and then what happens is the lungs also have to expel carbon dioxide. They can't do that, so then the carbon dioxide builds up and we go into respiratory failure. So the whole thing is just horrible.
Have you seen quite a bit of people attain COPD through secondhand smoking?
Well, interestingly, secondhand smoke leads to an increased risk of lung cancer. That was proven in the 1980s, but there's no literature that tells us that secondhand smoke causes obstructive airway disease or airway limitation. But it does cause bronchitis, and like Loni was saying earlier, asthma, airway irritation, sinus problems, throat irritation. Yeah.
It's a very funny thing, because I remember seeing commercials when I was at the hospital. They're playing them to educate the patients. Back in the 40s and 50s, 30s, they were actually saying smoking is good for you, and doctors are prescribing it. We've come a long way since then.
We have come a long way.
Yes.
Yeah.
Or the dancing cigarettes, you know, with the,
That's right.
the dancing cigarette packs.
Yeah, that's right. I remember watching those commercials as a kid on television. It's true. You know, anyone who's watched someone, as I know you have, Loni, in the end stages of life with COPD, this is one of the most unpleasant, I'm sorry, but it's one of the most unpleasant ways to die I can possibly think of. Watching this is a terrible experience. It is terrible for them, but it breaks your heart to watch it. Was that your experience?
Certainly, it's like drowning.
Yes.
My father was just, I had to come home after his death and put together a whole collage of happy pictures of him so I could try and get that image out of my head, you know, so that I could walk past a picture of him hanging on the wall every day and remember him the way he had been, because it was a horrible, horrible death.
Wow.
Terry, after your experience, what do you tell people?
Well, my best advice to somebody is don't smoke.
Don't smoke.
Don't smoke.
Just don't start.
And, you know, I quit a million times, but I think once you decide to quit smoking, you can quit smoking. But it's a terrible, you know, I'm getting to the stage where your folks are at, and, you know, I'm making jokes in there, laughing and everything, but it's a very, when I think about it, you know, struggling for air, gasping for air is not a nice way. And I think of my sister who had both emphysema and leukemia, and I think she was very glad that leukemia got her first.
Yeah.
Wow.
You know, because she knew what was coming for her.
Are there things that you have found that helped you with quitting smoking that you would recommend to other people?
No, just be aware of what it's doing to you. You look at me, for example. I'm quite old looking. I'm only 26. No. But the truth of the matter is it makes you look old.
Yeah,
it makes your skin thin, wrinkle, and you know from your parents. But it's just terribly destructive. Once I decided to quit smoking, it was actually very easy. But it's coming to that decision.
Dr. Krueger, there are a lot of people that want to stop smoking, but they can't. So what can they do?
Reset their mind. I can do it. Pick a date, pick a time, pick an anniversary, a birthday, maybe your child or your grandson or somebody's birthday, something special. And then there are assists, there are ways to do it. The brain is craving nicotine. It's not craving a cigarette, it's craving nicotine. There are patches, and there's gum, and they don't require a prescription.
Do they work?
They do work. 30% of the time, 35% where people are able to quit with those type of assists. And there are pills too, bupropion, Chantix. There's nicotine inhalers, Nicotrol, which does require a prescription, but they work. It gives us a crutch, it gives us some nicotine, so that first thing we do when we get up in the morning, we don't crave nicotine.
Yeah. So pick a date, pick a method, pick a reason.
Correct.
Pick a reason. On that note, we'll take a break and be right back with a final word right after this. Information is critical, it's important, but even more important, I think, is maybe an appeal from someone you trust. I'm going to ask Loni to make that appeal.
That appeal is, if you're smoking, stop. It's never too late to stop. You extend your life when you stop. Just imagine all the people in your life that you love that won't have to take care of you if you stop. And of course, just don't start.
Don't start.
Don't start.
Thank you, Loni.
Thank you.
Thank you, Terry, for sharing and your story, and thank you, Dr. Krueger, for the information you've shared with us. Has been vital. Go to our website, lifestyle.org, and we'll have resources there listed for you so that you can find the organizations that can help you with your issue in this area. Thank you for being a part of this one. We look forward to seeing you again. But until then, you take care of yourself. Bye-bye.
To get a copy of today's offer, call 888-940-0062, or you can write to us at Lifestyle Magazine, Box 1000, Thousand Oaks, California, 91359. And be sure to visit our website at lifestyle.org.